Hi, my name is Flora van Liemput. Today I will be presenting our research on the influence of frailty and multimorbidity on immunotherapy-related toxicity in older adults with cancer. This work was conducted in collaboration with Dr. Bonilla and supervised by Dr. Verschoor. As cancer care continues to evolve, immunotherapy has emerged as a new standard of care for many solid tumors commonly diagnosed in older adults. By harnessing patients' own immune systems to fight against cancer cells, immunotherapy offers improvements in both response and survival rates. However, one of the key challenges with immunotherapy is the development of immune-related adverse events, which can occur in up to 76% of patients. These adverse events can affect multiple organ systems and severely impact a patient's quality of life and their course of treatment. Current research has indicated that the risk of these adverse events is higher in individuals aged 65 years or older, particularly for those who have complex health conditions. However, it remains unclear how common geriatric conditions such as frailty and multimorbidity might influence immune-related adverse events. To investigate this further, our research was driven by three main objectives. First, we wanted to characterize the incidence and severity of immune-related adverse events in older adults with cancer who received immunotherapy in Northern Ontario. Secondly, we aimed to evaluate the association of frailty and multimorbidity with the incidence and severity of immune-related adverse events. And finally, we wanted to investigate the effect of frailty and multimorbidity on the overall survival of patients. To explore these objectives, we conducted a retrospective cohort study of 623 patients who were diagnosed with any type or stage of cancer and received immunotherapy between 2012 and 2022 at the Shirley and Jim Fielding Northeast Cancer Centre in Sudbury, Ontario. To assess frailty, we constructed a frailty index based on a deficit accumulation model, which quantifies frailty as the proportion of health deficits a patient has. Our index was based on 29 health variables, covering comorbidities, functional status, and mental health. For multimorbidity, we counted the presence of 8 chronic conditions, such as high blood pressure and diabetes, generating a cumulative score from 0 to 8. Looking at the results, Table 1 shows the characteristics of patients and immune-related adverse events in our study. The median age of patients was 69 years. The median frailty index score was 0.3, which falls within the moderate range, while the median multimorbidity score was 1, which represents 1 additional chronic condition. And most adverse events reported were mild in severity. Table 2 shows us the association of different factors with the incidence of immune-related adverse events. We found that both older age and surgery were significantly associated with a higher incidence of adverse events. Receiving chemotherapy in combination with immunotherapy was associated with a lower incidence. However, both frailty and multimorbidity were not significantly associated with the incidence of immune-related adverse events. Table 3 shows our efforts to assess associations with the severity of immune-related adverse events. Once again, older age was significantly associated with the greater severity of these events, and no significant associations were found for frailty or multimorbidity. For overall survival at the bottom, Figure 1 shows us that patients in the highest frailty category with a frailty index score greater than 0.4 had a 78% higher hazard of death compared to the lowest frailty group. However, Figure 2 on the right shows us that multimorbidity was not significantly associated with mortality. In conclusion, while frailty and multimorbidity showed no association with the incidence or severity of immune-related adverse events, age was a consistent predictor of these events. And this suggests that aging-related factors beyond frailty and multimorbidity influence treatment toxicity. Additionally, frailty but not multimorbidity was significantly associated with overall survival. So looking towards the future, there is a need for further research into age-related measures, such as biological age, that can improve our ability to predict immunotherapy-related toxicity. This can help to guide and personalize treatment decision-making and promote quality of life and treatment continuity. Thank you to all the contributors for their support in this research. We really appreciate you.